Hello, 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 and good afternoon, everyone. Thank you for joining us for our afternoon webinar on testing 123 Philadelphia community feedback on a home-based viral load testing device to support HIV cure clinical trials. My name is Dr. Tashina Reeder, and I am the director of the Community Health Training Alliance, and I'm thankful that you've decided to spend a little time with us this afternoon to partake in this important webinar. But before we get started, I would like to first provide you with some housekeeping reminders. The chat box has been disabled. However, per the instruction of the presenters, during a portion of an interactive activity, I will allow the chat to be open to participate in any questions that you may be asked to participate in. Outside of that, I'm going to ask that you use the Q&A box to ask all of your questions, because at the end of the webinar, we will answer all of the questions you may have. So we want to hear from you. Ask your questions, pose your thoughts or concerns so that we can address them accordingly. So without further ado, I'm going to pass over the webinar to Reese. Thank you all for participating today.
Thank you so much, and welcome, 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 everyone. We have been having a wonderful conversation today with the community, and I'm so glad that you're here to join with us. We've got some exciting information that's a game changer, basically, and you're going to hear from some of the people who had a firsthand account of handling this new device. I'd first like to introduce myself. My name is Reese Maddox, and I am one of the co-directors of the Development and Communications Committee, and I am the secretary for the Community Advisory Board of the Beat HIV 2.0 Delaney Collaboratory. And today we are so fortunate today to have our panelists with us, which I'd like to introduce. And we'd like to start with William B. Carter. William is the chair of the Beat HIV CAB, and he's a current HIV outreacher and an engagement educator. Just wave your hand, Will. That's Will Carter. We also have Andrea Lamore Harrington, who's here. She's a field coordinator for the Philadelphia Department of Public Health, as well as an associate minister at Whosoever MCCP Church. Andrea is also a CAB member of the Beat 2.0 Delaney Collaboratory, and is also on the board of directors for Philadelphia AIDS Thrift. With years of experience in activism and working in the field of disease prevention and HIV testing, Andrea is forever fighting for what is right and for what's fair for everyone. Thank you for being here, Andrea. Give a little wave to everybody. Thank you so much. And our researcher that we have here today is none other than Harsh Agrawal. Why don't you give a little wave, Harsh? Let me tell you a little bit about Harsh. She's a first-year Global Health MPH student at Gilling School of Public Health, UNC Chapel Hill. Shout out to Chapel Hill. Harsh is passionate about sexual reproductive health, and his research interests include pre-exposure prophylaxis, or PrEP, long-acting injectable ART, and ethics around HIV cure. Prior to his coming to UNC, Harsh worked towards digital demand generation and service delivery for populations vulnerable to HIV in India. So we thank all of you for being here. Thank you for those of you who are listening. I can't wait to jump right into this conversation. Before we do, I just want to give you a little background here. Frequent viral load testing is necessary during analytical treatment interruptions, which we call ATI, used in HIV cure-directed clinical trials. And so to make that in sort of simple terms, if a HIV person signs up for a clinical trial, often they have to come off of their regimen of medication. Because they come off of their medication, they have to get tested very frequently because the health providers don't want your viral load to spike and get high, which could cause you to get sick and subject to different illnesses. However, that can be very burdensome to the person in the clinical trial. You have to travel, you have to go take labs, you have to wait in line, you have to get your tests. You all know what that process is like. Now comes the game changer. A novel experimental device has been created where you could take the test at home and mitigate all of those traveling and dealing with the doctor's office. And you're fortunate today because we have firsthand people who have had used the device themselves. So with that said, some of the purposes, just like explained on the slide, there's no need to travel to the doctor now. No need to be waiting in line. No need to draw blood from veins, receiving test results at home. Who could ask for a better scenario? I'd like to jump into some questions right away, and I'd like to start with Will. Will, could you tell us why you initially wanted to be involved in the clinical trial?
First, I'd like to thank everyone for coming and being a willing participant, and to reiterate participant, because everybody, no matter which way that you decide to do the way that I have, which is being an active participant or showing solidarity like you are now, hearing what's going on, so you can know that you're capable of doing it. And part of the reason why I did it is, one, I'm an activist, and I decided to actually drop out of the trial, but I had a family member question me why I would chair a group and why I would recruit people for studies that I wouldn't participate in myself. So I decided to put my money where my mouth is, as being the chair of the Beat HIV CAB. Who would be a better person than to do this than myself? And it was a wonderful experience for me. So I would like to invite you all, if there's any clinical trials out there for you, even if you don't do it, still promote it to someone else. Let them make that decision for themselves. That's the recruiter in me, folks. Sorry.
Thank you, Will. I appreciate that. I'd also like to ask Andrea, could you share with us what was it that caused you to want to take on this clinical trial?
Well, actually, it was my conscience. And also it was, I'm very big on listening to my elders and honoring my my past, how can I say it, forefathers and foremothers, and all that they went through just for me to be here in this experience and have some of the freedoms that I do. And I remember something that my mother used to say. She told me that don't complain about failures or things you don't have enough or you don't have what you want if you did not get up to try and find an answer to the question that you're questioning. Now, if you're willing to get up and help find an answer and help find a clue, then you're worthy of the conversation. So me being HIV positive, I couldn't tell my children and my family what to do as far as keeping yourself safe for HIV, or what to do if you're HIV positive and you need medical care or you need this. If I haven't gone that extra mile to see to it that some of the meds that we use are safe, some of the ways that we get our numbers are safe. So I decided to participate in the program just to honor all of my ancestors, and to also show to my children and my family that you sometimes got to get up off of your butt and participate in order to help get these fancy answers that we're asking for.
Thank you, Andrea. I appreciate that. And for those of you listening, depending on how your screen is set, you may be able to see the little device on the right-hand side of your screen. But if you're not, I understand, Andrea, do you actually have the device there that you could show the viewers?
Yes, I do. Yes, I
That would
do.
be wonderful. And could you give us an idea how this device works?
Yes, I will. It comes in a small box, as you see in a package that I have to open up. Now, I don't know. Let me see. This thing does not want to show up here. Can you see it?
Yeah, I could see it a little bit. Okay.
Okay. It's a little device that's not even 3 inches long, and you put it on your shoulder, or as we found out that some people can't use their shoulder, they may have to use their leg. It has a little red button on it. When you attach it to your arm, you push in the red button and hold it for a couple of seconds. That pushes in a little needle inside of the device into your
Could you
arm.
hold it up a little to you so we could see it if you can? Right there next to you. Yeah, okay. Wonderful. Go ahead, continue.
And you press the red button that holds the needle in your skin for a couple of seconds. And once the needle punctures your skin, it's a little tube inside the device that collects the blood that comes out. And once you see that tube filled, then you know it's time to take the device off, and you put it back away in the envelope they give you in the box. Close the box up, and you put that box into a large express envelope, and you take it to Federal Express, which is right at the drugstore, very convenient, and it's there overnight.
Oh my goodness. If that doesn't sound like a game changer, hold that up one more time, just so that they could get an idea what that looks like. That is a game changer. No more running to the doctor's office and standing in line and transportation. You could do it all home. This conversation is lit. We are going to have a great talk. Let me go back to you, Will. Tell me about your experience using it. How was the device? Did you use it the same way that Andrea did?
No, I didn't, because William is a very horrible stick. Normally, when I go to the doctors, I literally get stuck between 20 and 27 times trying to draw blood. I have to go in there, drink water. I have to walk around the hospital or the office, do 10 to 15 laps just to get these old veins working. But what Andrea neglected to say there, that you don't wait until the chamber fills. It's a whole 6 minutes of your life. That's all. Total about 7 minutes from the time you wipe your arm, that the supplies is given to you. Get a wipe, you get a warmer, everything that you could need to make it easy for you. And I guess it's kind of scary at first, because if you're a person who doesn't like to get stuck, especially because it will remind you of a diabetic device. But the only thing with this is you actually don't feel it going in at all. And it takes away the worry of you thinking that you're going to have all this excess blood, but you don't. But when you pull it off, you may see a little tiny ring of blood, and all you do is pull off this little strip of plastic, and it actually dries the blood. So when it gets to the lab the very next day, it's already dried. There's no blood, there's no mess, there's no way of it being contaminated by anyone else, or tearing down stigma that you're putting blood, giving it to someone else. And one of the wonderful things during the trial that they did, if you actually took it into the Rite Aid, it gave you a nice 20% discount on your whole entire bill. You know, you may have the longest part of dropping it off if you went into the Walgreens was waiting in the line at the register for them to take it, or you can go to any box. But I call it instant because it only took a total of maybe 8 minutes of my life instead of for myself, going to the doctors is a 4 or 5 hour process just to get there, and actually sitting around a bunch of people that I don't want to be with. But the privacy of your own home and the ease of it, I taught my, at that time, 9-year-old granddaughter how to place it on me. So it's easy, convenient for everyone. And for those who have a fear of being found out, if you still aren't public with your diagnosis, no one will ever know what you're doing.
Thank
So
you
it's
so
wonderful.
much. Thank you so much for that, Will. I'm sure people are already trying to find out how they could get their hands on this device. But hold off, everybody. We still have more that we want to talk about. Thank you for that. Can we do the next slide, Harsh? Because I'd like to talk about, just for a minute, we conducted 3 studies with different participants each time. During the first 2 activities, which we call B1 and B2, we conducted one-on-one interviews and focus group discussions among people who live with HIV. In B3, we fielded an online survey with closed-end and open-ended questions to people who are living with HIV. So can we go to the next slide? Some of the reactions that the community had at large about the device was it was helpful during COVID, that it was very user-friendly. Andrea, tell me some of your reactions you had to the device for using it.
Well, it was so simple to use compared to actually going to a doctor's appointment and everything that you deal with the appointment other than the doctor helping you with the device. Or taking the test. It just took all of that away. And as Will said, a few minutes and you're done versus all the time it takes you to get to the doctor's office. And then once you get there, they never see you right away. You have to sit there and wait. And then when you get in the doctor's office, he's fumbling with paperwork and computers and putting stuff in the system. And it gets to be bothersome. This, within 10 minutes, you have started, finished, on your way out the door. And I loved it.
Ooh, thank you so much. Hey, Will, tell me, what was some of your reaction? Did you find it, someone said mind-blowing. I think that's is that pretty good description of what it's like?
It most certainly is. It is mind-blowing because you think of this little tiny device that as a community member, I had a say-so on how it would be used and asking, pertinent questions on how it would benefit not only myself, but my community that I would represent. It was so mind-blowing to discover how easy it was to use. They teach you when you're at your appointment with the researcher or at your doctor, wherever you will receive it, how to use it. And the great thing with it was, it was on the back of the package. You can go online and watch a video. And the amazing thing is, we know how we all hate to call because we get transferred 9 million times just to get a recording until you have to call back tomorrow.
Amen.
No, you actually got picked up within a minute or two. But for them to walk you through it, and the first time it's intimidating because you're not used to it, but you actually know how to use the convenience of it all. It's a wonderful thing. And as a researcher, I call myself a researcher, but I'm not a researcher, but a person who recruits for research. It was wonderful to, if I was at different meetings, being able to share with my colleagues and actually show them in real life time what exactly was going on and to field their questions. And that also bridges the gap between medical and the community. So we were actually able to not be at that virtual table. We were actually in the lab right along with those people who were coming up with it, with the pharmaceutical company. So is it mind-blowing for a person who, I think I'm the only one on the panel who doesn't have a degree, but to sit there and to be asked questions and to throw questions at them and to give an input and to see it come to fruition. There's no other way to, but to see how the beat is so innovative, progressive, and they align themselves and they actually listen to the community. So once again, I'm gonna tell you, research is and testing is not what it used to be. So just throw that out of your mind and ask a question as we hope that you will ask us later on today.
Thank you, Will. Some of the other reactions, let's go back, that the community had was that they were excited. Some said it was easy to use. We had people who said it was practical and reasonable, timely, innovative, and progressive, mind-blowing, revolutionary. The FCC was about using the device, similar to diabetes device, a helpful tool during COVID, user-friendly, and convenient. So thank you both for that. I'd also like to share some of the perceived advantages that some of the community members had about this device. And they were concerned, is the device safe? They wanted to know if it was painful. They wanted to know if it was time-saving. So share with me, Andrea, your experience of these advantages to using the device. Was it in fact safe? Did you find it discreet? Did you find it some of these words?
Yes, most definitely. My favorite part was with my job working for the health department and with my hat being in so many different rings, you know, Philadelphia AIDS Thrift, this board, that board. I'm always in meetings, and with COVID and we're doing everything remotely and whatnot, it was no telling where I would be, but then I still have to do my device. It was so convenient and, how can I say it, discreet, that in between meetings, it was nothing for me, as long as I had the device in my purse, to go into the bathroom, excuse myself, and within a couple of minutes, I've done my tasso, put it in the bag, rolled it up, put it back in my purse, walked out to the drugstore, and no one knew what was going on. No one knew that I had just done the device, and I was in no pain and could continue on to the next meeting, to the next board. And it was just, it was safe because I didn't have to worry about no one being around my blood. It was just everything wrapped into one.
Wonderful. And I'm curious, did you find it cost saving when you went to the store? Was there a charge for it? How did that work?
No, no charge whatsoever. When I would get my devices, they would just give them to me with the bag and I keep it moving. And each time, even though they tell you how to ship it, how to, handle it, all of that, each time you would go, they would re-explain to you, okay, you sure how to send it back off? Are you sure do you need any help with, using the device? They did that every single time for me, even though it was pretty easy, still just to make sure I had an understanding and had a hold on what was going on.
That's wonderful. Thank you for that. Hey, Will, I'm curious, did you find that it was safe, or did you experience any pain? You did say you weren't great with needles earlier on. So how was that experience for you?
To me, it was disappointing because I was looking for some pain and I got absolutely none. So it was, I don't know how big that needle is inside, but when you go to press it on, you have to hold it really good for you count to 3 and you hold it on. And it actually stuck on the first time. A couple of times it may not have, but to see it actually stick to, and then the annoying part of was pulling it off, you didn't get any pain. I'm looking for blood drips and leakages and all those things. And the nice thing about it, because you're worried about, okay, I'm sending this back to the lab. But when you dropped it off at the convenience for me, I'm in between a FedEx drop box and a Walgreens. But when you dropped it off at the actual Walgreens, you actually got notification that they received it. So that pressure was me, that I know I fulfilled my part. And my experience was a little different with Andrea. She did hers more privately. Every chance that I got, I shared with my colleagues so they would know what we were doing, and to share it with our board because they were actually giving advice on how it should be used and how it should be made and all that. But to actually help motivate the community who were actually had the input on it, to show them exactly what they've done. It was absolutely a source of independence, life changing, and cost saving. Who doesn't like a nice 20% off of anything in the whole entire store for the whole entire bill? So I used mine weekly. I took mine into the store.
That's wonderful. Thank you, Will, again for sharing that. And before we move on, I just want to pause a second to remind the people listening, and for those who may have just tuned in late, that this is a community-driven conversation that we're having with the actual participants in an HIV clinical trial who used a novel experiment device. And I believe Andrea has it. So could you lift it up again for us, Andrea, to show the people it's very convenient, it's very small, and I'm calling it a game changer today. So as we go on with the conversation, there are some possible concerns. And I also want to encourage the listeners, feel free to use the Q&A if you have any questions. We're going to answer them all at the end of our conversation. So some possible concerns that the community had, Andrea, was sensitivity of the test results, insurance, does it leak or bruise? What was your experience with using the device itself?
Well, when they first explained to me where you had to put it, I'm a person, I get hot flashes a lot. So I don't really wear a lot of long sleeves, but I didn't want to wear long sleeves if I was going to be bruised or a whole bunch of poke holes in the side of my arm. But as Will stated, I got a shock because, yeah, I mean, it gives you a little, it's a needle. So of course you're going to get a little teeny scab, but it was so small and minute, it really didn't matter. People didn't see it. I felt it, but you couldn't really see it from the outside. And after we got done, I didn't have any bruising on my arm. I didn't have any scars, to this day from using the device. That was my main concern. And the leakage of blood. But when you go to take it off, there is none. When the tube is full and you actually take it off, you may see, of course, it may be a little bit of moisture of blood around the device, but nothing leaking, dripping out, nothing running all over the place. So you're not putting anyone around you in danger with your bodily fluid.
Thank you so much. And for Will, I'd like you to tell us about how did you feel about the mailing process? Did you feel as though it was safe? Did you have any trepidations about putting it in the mail? Was all the things that you need to deliver this to the lab available?
At first, of course I did, but that was answered the very first time I mailed it. But to chime in what Andrea was saying, the biggest thing that anyone would even know you wore it, because the kit also comes with Band-Aids. To me, that was the worst part. I hate Band-Aids, but pulling that Band-Aid off, because they stress the fact that you keep that area clean. So if you follow the instructions, the whole time that I use the device, I never once got an infection or a scab or anything like that. The blood that is on that area is so minute. Now, thinking back on when I used it, because they do provide alcohol wipes with you, if there was any, sometimes there would be no blood around the suction part that goes on your arm. But if there was none, I just wiped that off and put that on they gave you a portable chuck that you could put all your trash on. And I put it in there and I dispose of the things properly. But that was one of the things that they stressed, was getting rid of our materials properly. But mailing it, no, because no one has a chance to touch it. It doesn't say blood on there, but it did have a warning of things on there, of hazardous material, but that could have been anything. So once again, if you were not out like myself, no one would know what you were sending through the mail. So it was very free, and as you know, a lot of stigma comes along with being a positive long-term survivor or even a recent one. So it was quite helpful mentally as well. I like to throw that in.
Thank you for that, Will. I appreciate that insight. I'd also like to now talk about some perceived facilitators with the device. Andrea, how did you know how to use it? Did it come with a video? Did it come with a pamphlet? What were the instructions like? Tell us about it.
Well, when my doctor actually explained everything to me, when Dr. Mounzer came to me, and he didn't just tell me about the device, he gave me specific instructions and made sure I understood what he was saying, how to use it. And they gave me the link to a video and sat me right there at the computer in the doctor's office and allowed me to watch the video. And then we worried about consent, because they wanted to make sure that before they even asked me the question, would I like to participate, or, you know, am I okay with this? They wanted to make sure that I understood exactly how it worked, the mechanism itself, and do I think I could handle that alone? And after watching the video and listening to Dr. Mounzer's instructions, it was a piece of cake. I had no fear whatsoever.
Great. You know what? I believe people are really getting excited about this, because this conversation is just off the chain. I can't believe how a game changer this is. No more running back to the doctors. You can take the test at home. This is amazing. I'm so glad we're having this conversation. I do have a question though for you, Will, as we're talking. There was this concern of environmental friendliness. Having this device at home, was there any problem that you felt storing it or keeping it in a safe place? Where did you keep it, and what was your accessibility to it? Because if I understand, you have children sometime at home, don't you?
I have a granddaughter that stays with me about 90% of the time, but she's also where I am totally out with my diagnosis. And she has always helped me, even as far as giving me, when I was a diabetic, insulin and finger sticking. So the biggest thing was when I brought it home and showed her. Of course, she was curious because as Andrea would attest, it looks like a Lego. It's about the weight of a single piece of a Lego, so it's not going to rip your skin or pull down on it like that. But I find out when you don't keep secrets and show them what it is, it's just like my medicine. My medicine sits on my dining room table, and none of my 8 grandchildren touch it because I've explained what it is. It's not a toy, and the importance of it and how it helps, how it helped Papa. And also to explain you, Andrea touched on it a little. I went to the lab and I dealt with the head research nurse, Kim Lynn, and each and every time, which is important, no matter if I went into the office twice a week, each and every time we went over that consent form that I initially signed a while back, over a year ago. We went over that to make sure that I was comfortable and still wanted to participate in the study. So even if I did not want to, they made sure that I knew, as Andrea said, each and every time that I was aware of what I was doing, I was asked questions. So once again, with this particular study that I'm vouching for, all your myths are thrown out of the window. So whatever you think, don't even listen to me. Go check it out for yourself.
Well, since I have you here, some of the community members were concerned before we move forward about they were concerned about it. Is it prepaid, or how do you know when to take the blood test? Do you get on your phone, do you get a message saying it's time to do it? How do you keep on top of how often you should be testing yourself?
Well, I must say for me, have a medical reminder on my phone. So I have that. And also, like I said, Ken Lin down at who's the head research nurse over at Penn. Ken was very friendly and kind. Ken always called you the day before. It didn't make a difference of what time of the day that you took it. But for me, because I'm out early, I did mine at between 7 and 7:30. You write the time down on outside of the box, and it's already labeled for you. You put the label on, and I normally drop mine off within that morning, but I did miss one day of doing it, but it didn't mess anything up because once again, the blood was dried and they reconstitute the blood that is inside the device, not outside of the device. There's no leakage or none of that. So if you're worried about the folks in the lab, I'm going to tell you that they all take universal precautions there as well. And being a healthcare professional, I took those things and I practiced those things. So no matter how minute the blood is on there, it is still fluid, and everybody still has maybe a misconception of, oh, I'm going to pass something along to it. I'll admit sometimes I do, and I know a lot about HIV, but I still want to follow the rules. So my thing, as they stress down at the lab, follow the example that they gave you. And if you had any questions at all, I know was given to me, our, the person that I see which happened to be Ken. Once in a while, I may have saw his assistant, but they reiterated, try to mail it that same day. So you don't have a 15-minute time period. And if you miss it, it's dry. It'll just get there a day later and you'll get your results.
Right. And one of the things I could see from this myself is that it can be used no matter what clinical trial you're doing. So it's not just a one size fits all thing. It could be used for multiple different kinds of trials, which again, is why I say it's a game changer.
This is, Reese, I will tell you, if there was a, just thinking off the top of my head, this would be great for a diabetic. I can see it not just only using for HIV. This can be used for a woman during her pregnancy. That would, not unless you were having problems, once they work out all the kinks to it and find out what's going on, that would free up so much time. Because as you know, things are virtual. Our world has changed. So this, like we said earlier, it is a game changer.
Yeah, I will have to say, however, based on some of the surveys that we've taken, there were some perceived barriers that we took a note of that the community had. Some of them, they were concerned about transportation issues. They were concerned about the limited their dexterity and cognitivity, device malfunction. Could you share with us, Andrea, your experience? Did it ever malfunction? Was there any problem getting it to, attach or the blood able to be drawn? Share with us that experience.
Well, in the beginning, I'm not a bad stick, but I do have one good side as opposed to the other side where I can't, it doesn't want to work right. But the first few times I used it, perfect, right on the point, filled up immediately. Then all of a sudden, I could put it in the same spot. I can drink water, do all of that, nothing. But it was just a few of the devices, just maybe the spring wasn't working right or something like that. And I would get frustrated because I would internalize that, like I did something wrong or I didn't do it right or something. But then I had to, in doing it with my doctor in the office, we had to come to the conclusion that maybe this is a trial device right now. So this is not the end result that will be mass produced and put out. So with any trial device, there's going to be small errors like in the mechanism itself, the design or something like that. but it was nothing great that made it painful or added to the experience. It just may not have collected, that particular device might not have collected. So I take that, pull it off, and try another one. And usually by the second one, it would do what it had to do. That was the only thing that bothered me, because I would internalize everything. So that's just myself.
Right. I appreciate that, you sharing that. And I think that's why this device gets to be called a novel experimental device. Andrea, show that again. Let those people see it again. I'm really excited about this device. Look at that. You can put it in your pocketbook. You can put it in your pocket. It's so convenient. Thank you so much for sharing that. Will, could you chime in while we're talking about some of the perceived barriers that people have? Did you find any, I assumed there was no transportation issues now, right? You didn't have to go home or anything. But was there any issues about it malfunctioning? Did you have any problems that you'd like to share?
Now, as Andrea stated, that just like if you use an area too much, if you're doing finger sticks, for those of us who have done it as a diabetic, if you switch up the area where you put it, for me personally, my arms were no good. My forearms didn't work as well. We used the lower part of my forearms. I dropped my pants so much I had to wear shorts. So, but my thighs were great. They gave up that blood. And I must say, you do feel a little defeated if you didn't get all 8 chambers. It's maybe 8 or either 10. I can't remember. I haven't seen the device in a while. But if there's chambers, but if 2 out of those 10 chambers, there's a total of 8 chambers to fill. So even if they had 2 chambers filled, there's enough blood in that tiny little thing that Andrea can show you. If you look at your tip of your fingernail, that's the size of that little slot. That's all it is. You just fill that little dot right there. That's it. But it does, when you are passionate about and love what you do, as you know, those of us who decide to move forward and honor those who've come before us and do that, you do feel a sense of disappointment if you are unable to fill all 8 of the chambers, because you know, I was asked, as everyone, all the participants were, if there was anything left over for collections, if they would be able to use those for research. So each and every time I did that, I wanted my blood to be used. If you took it, use it. Don't throw it out. Use it. But the nice part about it was I was asked each and every time before I mailed it. So that freedom, when we talk about freedom, is it? And those of us who know me, those of you who know me, I mean, no, I use public transportation. That wasn't an issue. And even being a person who's disabled, if I can get there, anybody can. You know, your limits, as you said, the limits there is that device limits is what you set on it. It's not the device that sets the limit, it's you. So if you have to move it to a different area, by all means, just let them know, because as you said, it is a novel device. So we may not have thought of an area, but having that input, I know, because I do know this eventually will hit the market. We can put mine and Andrea's name somewhere on that box. I nominate us to go on the box. We can change the name.
Let's talk about these mailing samples. So most respondents would feel comfortable sending blood through the mail. And most have indicated, you know, different private couriers. Obviously, the benefits of that is you have the flexibility, not having to go to the doctor's office to pay the copay, and time and cost savings. And some of their concerns, as noted, was timeliness or speed of the shipping or lost in the mail. Considerations were a need for same-day shipping. I want to talk more in detail, Andrea, about the mailing of the samples and everything. What was that whole process like? After the blood is drawn, how do you, what is it that's provided, and what service was used to transport these items?
Well, after you get done with your actual sample, they give you a bag. I'm sorry, my camera's not showing some of these things. It's a small aluminum looking bag. You put the device in that small aluminum bag and it has the packet filter things to keep the humidity out of the packet. And once you seal that, the device in that silver bag, then you put that bag into a Federal Express bag. And once you put that, then you would have to go through 2 layers of that material to get to the device. Well, I don't think nobody's going through the mail trying to rip open packages to get to a bloody device. I don't think they're trying to do that. And it's packaged in such a way the courier could not get punctured, or you don't have to worry about them being anywhere near your sample. They cannot contaminate your sample. And in the entire time, once I put it in this Federal Express bag and I take it to the drugstore, which by the way, is so convenient because the Walgreens is closer to my house, less than a mile away from my home. My doctor's office is 18 miles from my home. That's a huge difference. So the mailing process made it so easy and so convenient that I'd much rather do the mailing process than go to the doctor.
That's wonderful. And Will, give us a little more specifics. If I understood right, you actually took it to the store yourself. Is that how you mainly did it?
I mainly did mine to the store a few times. I rode my bike over to the FedEx box. But what Andrea didn't say here, that little bag that we put it in, and you put that device to keep the moisture out, that bag is the bag that you inserted is bubble wrapped. So the device when it goes back is not moving all over there. It's not going to come through there. It is secure. You have to rip that tape off, and actually they probably have to use a box cutter to get that bag open. It is so convenient. My if I took my younger grandkids or my granddaughter to drop it off, they like to go to the register, because they know Pop-Pop's going to buy them something too. So I would let them turn it in. So they were used to, but I never know, as we age and getting older, all of us are, we have to train those who are behind us because they only know what we teach them. And that also tears down stigma. As this device, we may not have talked about it here, but it does tear that down because we take away secrets and things like that. They know what it is. They know it's not a toy. And it's a part of, it's my granddaughter's normalcy. It may not be yours, but my granddaughter's, that's her normalcy, to go with Pop-Pop to pick up his medicine, to drop it off so he could stay healthy.
That's wonderful. Plus, she'll become familiar with medication and she won't, misuse it, which is really good to teach your young granddaughter. Thank you so much for sharing that. Let's talk about sharing results. Some of the concerns, or I won't say concerns, people had different opinions about sharing the results. Some people would like to share the results with their primary care provider. Some just wanted to get the results themselves. Was there any conversation, Andrea, about how the results will be shared, or how would you like the results to be shared?
Well, for myself, like I stated, I'm so many miles from, I'm not even in the same actual city as my doctor. My doctor is in Philadelphia. I live in Chester, almost to Delaware. So that's a long trek. And I would much rather, in our patient portal, my doctor's office has a patient portal where you can go in there and find out any appointments you have, lab results, test results, all of these things. I would really like to find out that way. Where they can just post it in my patient portal, give me a, heads up. Hey, you got some results and they're waiting for you. And if it's something that I don't quite understand, then my doctor in that same patient portal, you can pose your question or send an email or a note to your doctor or practitioner, and they will get right back to you to answer your question and explain it to you. That's simple enough for me, and it makes it less complicated. And like you said, it's not a copay for me to go into the office. It's not a copay for me to go into the drugstore trying to pick up meds. It just makes it so much more convenient, and to get my results through when I can go to it any time of day or night, that would be convenient for me.
Thank you so much. One thing I thought, Will, coming to you next, was some of the participants wanted the device to provide the viral load results so they could determine if they were undetectable. Is that something that you think would be helpful for that device?
I think, in my own personal opinion, I would love for it to do that, eventually do that. And my doctor I live in Philadelphia, but my doctor is not in Philadelphia. I go on the outskirts of Philadelphia near Andrea to the doctors. So I go to a teaching hospital, so having my doctor's attention and him actually asking me questions and him bringing other physicians in, and also those of us who have medical case management for our HIV, having that sent to our medical case managers, because as you know, they want blood work every 3 months from you, or you lose your service. This also provides a way to keep you patient compliant with having your blood work sent to your doctors, because if you want to use services and have the state pay for it, or even your health insurance, if you have to end up paying for it eventually, because that's yet to be determined how that will be worked. But that convenience and peace of mind, knowing that it's major, and knowing that my doctor, while I was on this study, him and his colleagues were interested in what I was doing. And if they had any questions, I'm telling you, they contacted Ken Lin, and he answered them, within a timely manner. I can't tell you with the length of time, but I never got a call and say, have him call me. So it's a matter of preference for a person. I want my doctor to tell me, or I don't want my medical case manager to tell me. So, but having that choice and freedom, some people may want the results to come to them. If there's a problem, I only want the doctor to know. But myself, I'm going to the doctor if my eyelash goes to the left too far.
That's good. And I was glad to see that some participants felt that the providers should be involved also, especially if there's a need for any additional counseling care or any concerns about the results. I think it's good to have your provider also involved in it. And as we're getting to wrap this up, I wanted to share what's happening next. And so basically what happened first is that the clinical trial patients here that you saw, they received the information first about the document. And so actually what's happening next has already happened, in the sense they have now actually used the device firsthand themselves. And so now the data is being collected, and in the near future, we're going to hear the results and the data from all of this clinical trial that has happened. Before we wrap this up, I want to ask you one final question. Let me start with you, Will. Tell me, did you finish the trial, and what was your overall experience with the trial?
I happen to have a yes or no answer to this. I did actually complete the trial. I actually was qualified to do an extension, but during the extension, out of the blue, my viral load went crazy. So it was recommended by Ken and myself we going over that consent form, being aware that they didn't want to harm me in any way. So I did have to leave the trial. And so was I detectable? I was detectable for 3 months after 25 years of not being detectable. But I'm happy to say now I was detectable, found detectable in September. But when I went back to my doctor in January, I was not, and I continue to be healthy and undetectable since January of this year.
Thank you so much. Andrea, tell me, were you able to finish the trial yourself, and what was your overall experience?
Well, like Will, I can say yes and no. I made it all the way through to the end, to the very end. I think I might have had maybe one more appointment, and my viral load shot up. So therefore, Dr. Mounzer and the team sat me down, and again, just like Will stated, we went over that consent, and they made sure I understood that it was my choice, and that, you know, they're going to give me all of the information to help me make an informed decision. So they weren't trying to make a decision for me, and they wanted me to be safe. So we made the decision for me to go back on my meds, and within a couple of months, I was back undetectable. So to me, the whole experience, yes, I will admit, as a human, when I got done, I wasn't too pleased with the program, but that was selfish reasons, because I felt like I failed because I did not get to complete the mission. But once I sat back and talked to myself, and myself said, I had to get an understanding that, no, Andrea, you didn't do anything wrong. First off, that was, that's just the way it happened. Your viral load spiked up, and in order to stay safe, you need to go back on your meds. But that does not mean that the device was not working. That just means that that was life. And all of the valuable information that we will get later on from myself and Will and other people using the device, this is valuable. And as you stated, Reese, it is a game changer, not just for myself, but for my children coming behind me.
Thank you so
Can
much.
I add to this real quick? I want to say this,
Uh-huh.
and I'm going to speak for Andrea right here, because we both had the same results. Being able, because Andrea and myself, we shared at our monthly community advisory boards how we were doing. We gave weekly updates, but to see the support of the community wrap their arms around us, and those who are on the CAG part to rally behind us and tell us that we weren't failures, because we both felt that way. We're both overachievers, and to see everyone were like cheering us on and cheering us up, to know that they were very proud of us. So that was why that both of us still continue to be activists in our community, to do this other level of support that we receive from our peers.
Thank you. That's wonderful. And one thing that I saw as a huge plus is, even though your viral load spiked back up, if you did not have this device at home to take your blood, you may have had to wait, who knows, a week, 2 weeks to go to a lab and find out about it. And who knows what could have happened. You could have gotten sick. So once again, this game changer device helps even in the event that your viral loads get high, so that at least they can monitor you. And having to pull you off was a good thing, because they were able to monitor and find out what your viral loads were. And because you were able to complete the test as far as this duration, now we have the data to move forward, to be able to find even more information that'll be released soon. I do want to thank you both so much. This has been a wonderful conversation. And for all of you that had the opportunity to listen, there are so many people to thank. I really want to appreciate do you see that whole list there? I have no intentions to start to read all of those names. I'm sure I would just butcher them, but let me make a few points here. Thanks to Corinne Dubé, the head researcher on this, along with Harsh Agrawal, who has been working the slides. Thank you so much to Harsh, to all of those involved, to the Beat HIV Collaboratory, thank you. To the Beat HIV Community Engagement Group, much thanks to all of you. To Philadelphia Fight, to UNC Chapel Hill, and to the University of Pennsylvania. We want to thank all of you for your help and to your support. One more time, Andrea, put up that little device. We all want to see that device here. That is just amazing. Thank you all so much for your time and attention. We're going to take any questions that anybody has at this time. I think we have some in the Q&A.
Thank you for that great.
I'm sorry, go ahead.
Are you moderating the questions also?
No, you could go ahead. I didn't see you there.
Hello, and thank you again for a great presentation to inform us on the new technology out there that's available to all of those who are living with HIV/AIDS, who now have access to a tool to use to take their blood on their own at home in a way that's discreet and comfortable and all of that. So that's great to know that that is available. So let's check out the questions in the Q&A box. One question is, will your doctor contact you immediately if they see an issue?
Yeah, I can talk about that a little bit and also explain more. So like we said, this was B1, B2, B3, and the device was shown to the participants and their inputs were invited. And the next set, part A research, where Will and Andrea actually used the device, that results are being published now as we speak. So we're working on them and we are publishing it. But even in the A1 or even in the, when they used it or when they were continuously using it, the results from the device were not given to the participants yet. So the results that Andrea or Will got, that was from their standard viral load test that they would go in the clinic and get. So during the trial, they would do both the things. They would use the device and they would also go for their standard viral load test. So in future, when anything goes wrong, let's say your viral load is relatively high, your doctor can be involved and your doctor can contact you and guide you through that process.
Thank you. The next question is, how long did it take to become undetectable again?
For myself, I became detectable in, I can remember the date because it was the day before my birthday, September 10th. And I had, and my next doctor's appointment was January 12th. So between September the 10th and January 12th, I was no longer detectable. But during the meantime, when I became detectable, my doctor had me come in for bi-weekly labs, you know, into the office. So it was very manageable, and I felt like I went to the Walter Reed Center.
Well, for myself, they did the same thing to me. Once I became detectable, they started me coming into the doctor's office every 2 weeks, and they would do a viral load test. And by that third viral load test, so I guess that was 6 weeks, I was back down undetectable.
Thank you for sharing and answering that question. The next question is this device available to everyone or just trial participants? What do you mean by experimental device?
Right. So right now, this device, as we see, it's a work in progress. We are collecting more information and more data on how to make it better. So right now, it is not available to everyone or to general public, and it is only available to the participants who are participating in these trials. And by experimental, that's what we basically mean, that we are experimenting with it, and then we'll have the final product.
Can I say something to answer with that?
Yeah.
Even though it is experimental, if you wanted to, if you were fortunate enough to participate, this is the perfect way to enter doing clinical trials. It was so harmless. The amount of blood is not even the amount of blood that they would take from you going into the office, at all. I wouldn't even say it wasn't 10 cc's of blood. I'm not saying it was that much, but it didn't need a lot of blood. It took 6 minutes to fill 8 chambers. So it's not a lot of blood taken. So it was a nice way for a person who's scared of research to get into it.
Thank you, William, for adding to the answer for that question. There was a comment in that says that you guys are inspirational to one of the viewers. And there was mention about the device. I know that, Andra, you mentioned early on that your screensaver wouldn't allow you to fully show the instrument. Someone was asking about the instrument.
We can try one more time.
There we go.
If she turns off her background,
Yeah, maybe that will work.
then it will show it. If you turn off your background, you can fully see it then. If you go into participants and go down to that, there you go. Ta-da!
That's wonderful.
Yeah, perfect.
I'm not showing off. Harsh just taught me that before we went on camera.
Thank you, Andrea, for displaying the instrument again. Another question that was posed, do the researchers need to confirm that the device works as well as the standard lab test?
Yes, that's what we said, that's what is happening next. Like, because they did both the tests, they did the standard viral load plus they did the device. So we are in process of analyzing the data and seeing like what's the difference and how sensitive the device is. So hold on, that information will be with us very soon.
Awesome. And the last comment was just thank you so much for your presentation. I'm sure this was informative information for many of those viewing who are living with HIV and AIDS, and for those professionals who may not have been fully aware that this device actually exists. And so thank you for taking the time to educate us all on the innovative ways of capturing your counts at home. I think this is actually, someone said mind-blowing. I think it is actually mind-blowing how far we've come in terms of testing and all of that. So again, thank you all for sharing. In the audience, the viewers, if you have any last comments or thoughts that you may have for our presenters, feel free to add your comments in the Q&A box. To our panel, do you have any last words or things that you want to also add to this presentation?
I'd really like to say this much. My doctor, Mr. Karam Mounzer, and Philadelphia Fight, Lyndon, Emily, my Lizzie Smith, when I say they kept me so informed and they watched over me like a hawk. If I came in and if I blinked my eyes too many times, are you okay? Do you need anything? Let's go over here in the corner and talk. They was just on top of everything, and I cannot thank Philadelphia Fight and Dr. Mounzer and his staff enough. Thank you, thank you, thank you.
Can I chime in on that? I want to start with thanking Philadelphia Fight for giving me my start. It's because of different trainings that you all have that's posted on your the alumni newsletter for Project Teach, that we're able to take different classes and learn about HIV, to learn about doing research studies, and also going actually into the lab and talking with the scientists and being at the table, talking to the doctors and actually hearing. We complain that our voices is not heard, but I can only speak of on the 2 clinical trials that was the other clinical trial that's associated with this. Your voice was heard. My voice was heard. They hear you. They welcome your participation. So even if you cannot do what Andrea and I did, you're all heroes. And think of those that 15, 20 years ago, they would have never even talked to you or heard anything about you. So sitting here listening, please share this information that, as you see in the back, the Beat HIV, part of the Martin Delaney Collaboratory, that we're out there doing it, and we're doing it big for you. So do it. So do your part. That's the only thing I'm asking. Do your part to find the cure.
I would like to, if I can, thank again Harsh for helping me as we went through the slides. I'd like to give a shout out to my fellow CAB members. Thank you, Roy, who I know is watching, Roy Hayes, who's been very supportive. Shout out to Danielle Campbell, co-chair of the CAB Beat, who's been very instrumental. If you enjoyed my presentation, it's all kudos to Danielle. She was very good at coaching me and, you know, helping me to articulate the things that were shared today. So I really appreciate your help, and thank you again for this opportunity.
And we have one question, I guess more of a question of terms of access. So for my employment, I supervise individuals of all kinds. Therefore, I want to help my clients who are positive for HIV. What is the best place for me to refer these clients to receive resources?
I think it would depend the kind of resources you're looking for. If you're looking to connect to the device, I mean, you can write to us, you can share our email IDs, and we can connect to the relevant people. But if it is information, I personally always suggest go to your provider. They're the best, most reliable source to get more information.
And I can, of course, I can add to that as a representative of Philadelphia Fight. We are all things HIV care. And so if you have individuals who are living with HIV who are in need of services, feel free to reach out to Philadelphia Fight. We offer medical care. We have a behavioral health department where we're dealing with the mental health aspect. We have a women's program. We have a lot of different services at Philadelphia Fight to service those individuals who are living with HIV.
Can I say this to that? I welcome, you know, when you speak with your patient, that they do get into some type of treatment. But remember, every agency is not the same. It's just like going to the market. You go where best fits you. I receive services from elsewhere, but I always, everybody knows, I went to Philadelphia Fight University. And that's where I got my knowledge from and my training from, and people promote health and mental health. So go to Philadelphia Fight's a good place to start. But there are other agencies here in the city of Philadelphia that are wonderful. But if it's not a good fit there, it doesn't mean that agency is bad. It does not mean that at all. It just means that this place is not the one for you. But I do recommend everyone get medical case management if you're HIV positive and if you want to be a long-term thriver and not just a survivor.
Might I just add one more thing? And this is not to keep touting on Philadelphia Fight, because they are not the only shop in town. But one thing about Philadelphia Fight, yes, they serve the needs, any need that a person, HIV positive person may have. but they also have a clinic that will service your family members who are not HIV positive, and that is the John Bell Clinic. So for those of you who are positive and you don't want to necessarily have 2-3 different places for yourself and your family to go to, Philadelphia Fight does have care for yourself and your family members that are not positive, so that you might not have to go to 2-3 different locations.
Thank you, Andrea. Thank you all. So we have another comment. Someone put in the chat that you can also contact ACO hotline they have. So ACO has a hotline that you can contact and inquire about services specific to HIV services. This was a fruitful conversation. I believe many folks who are watching learned a lot, not only from your shared experiences, but also from the research aspect of how it all comes together. So thank you all for really leading the way to even participate in a trial to test out the instrument and all things research that you are involved in. So thank you for your work and your courageous way of wanting to help in the fight of HIV cure. So thank you, thank you, thank you, thank you, thank you, thank you, thank you. Did I say thank you? Thank you.
Thank you. Goodbye.
Goodbye.
So if there isn't anything else, we're going to end today's webinar. For those of you still watching, tune in tomorrow. We have a treat. We have a presentation tomorrow from an individual from Nairobi, Kenya, speaking on HIV testing attitudes and behaviors at a sports-based HIV prevention program in Kenya. So I think this will be a treat to hear how other countries are testing for HIV care. So tune in tomorrow. Be sure to register. And I will see you all then. Have a great rest of your day.
Goodbye.
Bye.
Goodbye.